The dream started with creating a group of nurses who everybody wanted in their department. When they showed up, they knew that they had managers who were rounding on them and doing active daily management, managers who knew that they would follow up on concerns and questions, nurses and staff from the float pool that knew up-to-date policies and procedures they could rely on, and they were a dependable part of their daily workforce.
As a float nurse, we go through different units and we kind of fill in where staffing needs us.
Float pool nurse is basically someone who is very flexible and adapts to any units they go to.
I do enjoy the flexibility. I like seeing different people and working with all the different staff in the hospital.
And they can go whatever situation you put them in. They're able to take care of the patient as if they're own.
We've asked them to take on responsibilities in a lot of different areas of the hospital, and they've done it with grace and flexibility.
They really work as a team. When they are in one unit, they're part of that team.
They're the nurse that can walk into any situation, and they're going to be able to pick up wherever somebody left off. It may be chaotic, and they can get whatever needs to happen done. And to see these nurses in action is just, it's a phenomenon in itself.
Not only am I excited to meet new patients and get all those experience, but I'm also excited to continue my education here at Stanford.
We have Skills Day and we touch on different aspects of nursing to train. And now that we have new grads in the float pool, we have them train in the different types of units that they may be floating to later on.
They're highly skilled. We spend a lot of time investing in their education. The nurses, for example, are almost all tele-trained. So even when they're on a med-surg unit, they have the critical thinking skills of a higher level of nurse.
One of the things about float pool that I have learned in the past 3 years is that they're really here for patients.
I enjoy being an advocate for people who need help, giving them a voice when they may be too sick to do so for themselves.
Nursing excellence is in our blood, and we give the best care to the patients.
We've worked diligently to create a reputation for our staff, and you feel it. And I know we've been a part of that process. It's been awesome to see that.